Three-dimensional imaging in dentistry. Dentistry has entered into the world of 3D dental imaging and diagnosis. The 3D imaging unit, which is about the size of a panoramic unit, can be placed in the dental office for dental application. This technology offers dentists and dental specialists comprehensive diagnosis data, improves information and interpretation for multiple treatments, and enables the design of treatment plans with more predictable results. It shows more information than traditional dental x-rays or CT scan. The 3D dental image scan shows an immediate 3D reconstruction of a patient's mouth, face, and jaw areas, including the condyles and the surrounding structure. Tooth position are visualized to show impactions in the alveolar bone, the location of adjacent teeth, and their proximity to vital structures, such as the mandibular nerve canal and the sinus walls. This technology provides an excellent image quality with fine three-dimensional details and the lowest possible radiation dose dissolved annulled. What is 3D imaging? There are a number of companies that manufacture 3D units that meet the needs of different clinic settings and that take a variety of images, including complete or partial skull fields of view. The units are designed to produce digital panoramic and cephalometric images and 3D photos, as well as cone beam volumetric tomography CBVT and cone beam volumetric imaging CBVI. Along with the 3D imaging units, there are many advanced imaging software tools to meet the requirements of dental radiology. With the 3D imaging device, the X-ray beam is cone beam shaped and aimed at a solid-state flat panel detector that covers the desired image volume. See the following note. In a single scan, depending on the imaging device, the image is usually captured in a single rotation around the patient's head. Traditional CT scans had a fan-shaped beam that required multiple repeated slice scans to accomplish a similar image volume. The cone beam shows hundreds of isotropic images of the patient from different positions around the scan rotation. The information is transferred to the computer, which reconstructs it into the anatomical volume for the dentist to see. The measurements and information gathered are dimensionally accurate and detailed. Once the data is reconstructed, imaging software is used for the multi-layer viewing of the anatomical volume. This information is then saved on a designated system in a format that specialists, dentists, and other imaging-related services can access. Wide selection of volume sizes are available to meet diagnostic needs without excess radiation outside the area of concern. Which dentists would use 3D imaging? Three-dimensional technology is becoming more familiar with many dental professionals as it develops and more dental offices incorporate it into their diagnostic procedures. The concepts of 3D imaging are designed to enhance dental treatment in the following areas: endodontics, periodontics, orthodontics, maxillofacial surgery, and general dentistry. Software is designed to produce the images and information each dental office needs for the treatment of their patient. Specialists and general dentists can store the scan information for future use, and it can be sent to other dentists working with the same patient case. Use and benefit. There are many applications for this technology in all aspects of dentistry. Three-dimensional dental image are recommended for the following: to provide data to determine bone quality and quantity, to locate detailed anatomy, to locate pathology such as cysts, tumors, and bone lesions, to evaluate deformities and pathologies, to view critical landmark and show minuscule detail, The details of the scan allow for early detection and evaluation, accurate planning and measuring for dental implant, to plan virtual orthognathic surgery, to evaluate TMD and the TMJ diagnosis analysis, to show the entire dentition and the whole maxillofacial and mandibular region, to produce complete and partial 3D face photo, precise measuring tool and improved general dental imaging, to locate and evaluate impaction and many other dental condition, for advanced treatment planning and assisted delivery ability. Software has been designed to make custom precision surgical guide, virtual model, and a laser generate resin model, spinal study, airway assessment. Patient preparation. With 3D dental imaging machine, the patient can have the scan complete right in the dental office. With the 3D dental imaging equipment, the patient neither stand nor is seated comfortably in an open scanner. Instead of being placed in the supine position, once the patient is seated, images are scanned in a very short period of time that varies with each machine, usually from 8 to 20 seconds. Once the scan is complete, information is transferred to the computer through different software programs. Software is quick and effective, reconstructing critical anatomy in less than 30 seconds. The software is designed to solve dental problems through perceptive integration of diagnosis, computer-aided therapy planning, and a detailed intraoperative implementation. Once the information has been successfully scanned, the dentist can show the patient the images and then discuss the diagnosis and give the patient an understanding of their treatment option. Handheld intraoral radiography. Another new technology is the portable handheld dental X-ray unit. These low radiation dose handheld intraoral radiography machines are battery operate and are being purchased in increasing numbers by dental offices and clinic. They have been available in other countries for some time and have aided in providing global access to dental care to clinic in remote areas of the world. The handheld system can be used in a variety of settings, including the following: military base, dental office, clinic, teaching facility, forensic clinic, nursing home, and out of the office use. The unit can also be used in times of power outage because they are battery operated. The handheld unit have a digital control panel that is simple and quick to use. Selection include adult or child, anterior or posterior bite wing, and the type of exposure medium, neither film, digital sensor, or phosphor plate. The panel also shows the battery status. The handheld units are usually preset at 60 kV and 2 mA. With most X-ray units, the exposure are preset but can be adjusted and saved manually. The batteries for most units are made of lithium polymer technology, and most units come with an extra battery, a battery charger, and a stand so that the unit is ready at all time. Most units take more than 100 exposure on one battery charge. Because the units are handheld, the operator is allowed to stay with the patient, thus reducing the time necessary when exposing X-rays. The handheld units are safe and especially designed with significantly more shielding around the X-ray tube and a backscattering radiation protection shield. This shield is composed of lead-impregnated acrylic, which block scattered radiation. The position indicating device, PID, or collimator, is also shielded. lowest radiation makes it safe for both the patient and user alike. This new technology requires education, time, intervention, and a willingness to change how X-rays are routinely taken by the dental team. The handheld X-ray unit is expensive and requires training before using. Several studies on the safety and quality of radiographs as compared to the standard X-ray machine have shown that the handheld X-ray unit is safe and produces quality radiographs, but there is still some reservation and the need for more research. Alexa, play Gypsy King.